Good afternoon, everybody. I'm going to give it just 30 more seconds for everyone to get connected to audio and video before we kick off our webinar this afternoon. We are anticipating as close to 50 people to join. So I want to make sure everyone has a moment to get connected. I think we'll go ahead and get kicked off with introductions. So welcome everybody to the Academy Advisors Message Testing and Narrative webinar. So glad to see so many of you joining live this afternoon. As a note, we are recording this session. There were a lot of individuals who were really excited to hear the content that were unable to join us this afternoon. So we will be sharing the slides and the recording in follow-up. We have wonderful guests joining us today who are going to go over our content. But a quick level set, the Academy Advisors has been thrilled to partner with Public Opinion Strategies on 2 national voter message testing polls. The first of which was last July, the second of which was earlier this year. And so we're pleased to have Jarrett Lewis and Luke Jackson from the Public Opinion Strategies team join us. They're going to go over the voter poll and the message testing results. We are also thrilled to partner with Next Solutions Group, and we have Carolyn Nagel and Dan Childs from NSG here today to go over some of the key learnings and takeaways for our messaging. So first I'll ask Jarrett and Luke if you all want to introduce yourselves, and then Carolyn and Dan, and then we can get right into it.
Thank you, Stephanie. Great to be with you all. I know some familiar faces in here. I'm Jarrett Lewis. I'm a partner at Public Opinion Strategies. I had the pleasure of spending 9 years at the Health Management Academy / Academy Advisors, and had the privilege of working with some of the folks in here today. And I co-lead our firm's healthcare vertical. So appreciated the opportunity to do this work with Stephanie and team, and excited to walk through the findings. I think there's a lot of good stuff in here. Luke?
Thanks, Jarrett. Thank you, Stephanie. My name is Luke Jackson. I'm the research director here at Public Opinion Strategies, working under Jarrett. Yeah, excited to walk through all this data with you all.
And my name is Dan Childs, and I am here on behalf of NSG, as Stephanie had noted, with my colleague Carolyn Nagel. I'm actually a managing director over at NSG, in charge of external communications and media engagement. But we are a corporate consultancy focused on reputation and how communication can enhance the reputation of organizations. I'm a former journalist myself. I was one for about 17 years. So this is actually a passion project for me in terms of being able to take a look at the messaging and see how we can really make it sing. Carolyn, I will hand it off to you.
Thanks, Dan. Carolyn Nagel here, Vice President at NSG. I work with Dan Childs in media relations and then also on the issues management side, and really excited to be here and present the data.
Awesome. Well, then let's get right into it. I think the only other thing I wanted to say, setting ground rules, given that we already have 41 different participants, we're not going to do a live Q&A today. So if you have questions, please put them in the chat. If we have time at the end, I will sort of filter through some of them and have our guests answer them. Otherwise, want to level set expectations that we will be covering this a little bit deeper next week with our comms cabinet. So for those of you who are also on our comms cabinet, we'll have time next week to kind of dive in. And then for others who are not part of our comms cabinet, we can cover this in future advisory council or GRO monthly calls. So hold your questions, place them in the chat, and we'll make sure that we have everything answered. If not today, then very, very soon. Jarrett, turning it over to you. I'm going to go ahead and advance our slides and let you take it away.
Great. Thank you, Stephanie. If you go ahead and go to the next slide, just a quick overview of what we did. We did a national survey March 7th through 11th of 1,200 registered voters. If you go to the next slide, this is the composition of our sample. So it looks almost identical to the U.S. Voting population. This is what basically the electorate looked like in November. So because we're surveying voters, we wanted to match to what the voting population looks like in the country. So you see that from age, gender, education, party, et cetera. So and then a couple of healthcare specific demographics on the bottom right there. You can go ahead and go to the next slide. I'm going to have Luke take the first couple of sections here, and then I'm going to jump back in when we get into the nonprofit status.
Great, thanks, Jarrett. So to start off our survey, one of the first questions we asked was just what's your top issue? What's the most important issue in terms of healthcare issues? And we found that cost rose to the top above all the other issues in healthcare. And we do a ton of different work nationally, at the state level, local level on healthcare issues. And we find, and this is consistent across all those different surveys and research that we do, cost is always the top concern for voters. And we also found that there's, there's perceptions of access to care as a growing problem in healthcare as well. And we'll dive into that in a couple slides here. Next slide, please. So this is the question where we asked, what's your top issue, your top priority when it comes to healthcare? So as you can see at the top, we asked for both first choice and second choice, top first and second issue for voters. And as you can see, the amount of money you pay to receive care, by and large, went away with it, with 40% saying that was their most important issue, followed by the cost of prescription drugs. And then when you look at first and second choices combined, you also see access to high quality healthcare providers in their area rising to the top. 33% selected that as their first or second choice. Next slide, please. So diving a little more into the cost issue, we wanted to understand how to better talk about how to make healthcare more affordable. So we tested a variety of different phrases here and ways we can talk about that. And you can see them listed out here on the left-hand side. And what really rose to the top were phrases like lowering healthcare expenses and enhancing affordability and reducing financial burden. What didn't work as well were phrases like streamlining costs and cutting healthcare spending. Those were not as popular to voters.
One of the things that we've seen, I'll just add a little bit of color to this one. We've done some work specific in specific markets, where we've done not to the extent we did here, but we've looked at lowering versus cutting versus reducing. Cutting for voters signals that potentially services could be cut. To them it signals that perhaps quality could be impacted. When you talk about lowering, when you talk about reducing, or even enhancing affordability, as you see here, it just resonates better than when you talk about cutting spending, because in their minds that may also mean cutting, lowering quality of care or lowering, other kind of adverse effects of cutting.
Thank you, Jarrett. Next slide, please, Stephanie. So digging a little bit more into the access issue, because we saw that rise up when we were asking first and second choice on the top issue, people concerned about access. We asked specifically how much, if at all, do you believe access to medical care like hospitals and doctors is a problem where you live? And in total, 62%, so more than 6 in 10 voters said that there was a problem in the area that they live, including a fifth of voters, 20%, that said it was a major problem where they live.
One just real quick on this one. We've been asking this exact question for 5 years, since 2020. And 4 years ago, that number, the 62% number, was about 50%. So in 5 years, we've gone from 50% to 62% of Americans who believe that access to care is a problem where they live. What's interesting to me about that is when you think about post-COVID, we have telehealth, we have more retail medicine options, we have more urgent care options, we have more distribution of care, but voters, Americans, patients, consumers, however you want to define them, they don't necessarily feel that. They actually feel like it's getting harder and harder to access care. Some of that's through some of the utilization management things that payers do, step therapy, prior authorization. But the point is, there's a perception that it's getting harder and harder to access care in America, even though I think we have more care distribution points than we ever have.
Thank you, Jarrett. So next we tested a bunch of different names of different entities in healthcare, including both health and hospital systems. We also tested the names of these entities if we put nonprofit before health systems and hospital systems to see how they compared. So image, when we talk about image, that means whether voters are favorable or unfavorable towards that entity. Another finding, we also found that 3/4 of voters agree that hospitals are hubs of their local communities. Next slide, please. So this breaks down all the different entities that we tested the image for. So as you can see, I'll start with the the bar graphs highlighted in red here. As you can see on the left, hospital systems tested a little bit better than health systems in terms of favorability. Voters are more favorable towards a hospital system than a health system. But as you can see in the green on the left-hand side, when you add that nonprofit designation before it, nonprofit hospital system, nonprofit health system, favorability jumps up by quite a bit. It was a net 20-point increase in favorability for nonprofit health hospital systems when you add that designation before it, and a 25% net gain in favorability when you add nonprofit before health systems. Also, just point out, we've tested health insurance companies. Voters are pretty mixed on their favorability towards health insurance companies, net unfavorable there, and not much favorability towards corporations either. Next slide. So this was prior to doing the survey, we did some online discussion boards to kind of help hone our messaging and our language that we use, and we tested in the survey. And one of the comments that came out is a voter described hospitals as hubs of the community. So we decided to test that and quantify that in a survey. And we found that more than 3/4, 76% of voters agree that hospitals are hubs of their local community. And this cuts across all demographic subgroups that we tested. You'll see that on the right here. The groups that are most likely to agree with this, or more likely to agree with this, are actually younger voters, voters of color, and voters in urban areas as well. So we also, when we tested the images initially, we just said nonprofit health system, nonprofit hospital system, and we didn't really give a description of what those entities exactly are or what they do. So we tested a variety of different descriptions of health systems, and we found that, you know, the more they learn about it, the more their favorability is driven up. We also found that more than 80% of voters believe they get good value from the healthcare they received at their preferred health system. The next slide, please. So these were the 4 different descriptions of a nonprofit health system that we tested. I won't spend time going through the differences in all these because they all tested about the same, but we played around with the language here to see if there was any differences, and there really wasn't. Next slide, please. So on the far left here, this is the initial image of a nonprofit health system. And then on the right side, you'll see the 4 different descriptions we tested. We quarter sampled these, so you know, a quarter of our voters heard each of these descriptions, and they all tested pretty similarly. But as you can see, favorability was driven up as voters were provided more information about what a health system is, what they do, the different kinds of services and care they provide. So across the board, it was anywhere from a net 29 to 42% increase in favorability towards health systems when you add that brief description and information about them. Slide. So next, digging into the value and cost of care, we tested perceived value for the cost of care in 2 different ways. So on the left side here, we asked them whether they agree or disagree with the following statement. They believe they get good value for the healthcare they received at the preferred health system. 81% of voters agreed with that statement. On the right side, we asked, thinking about the cost of healthcare at your preferred health system, would you say that the value received for the cost of care is excellent, good, not very good, or poor? And very similar results here as well. 81% of voters said that they get excellent or good care for the costs that they pay. Slide. So we also tested a bunch of various different benefits that health systems offer patients in the communities in which they serve. And these are what we can use to talk about, you know, when we give a description of what a health system is, the benefits they provide and what they do. So these all tested extremely well, as you can see, all above, you know, 65%. So more than 2/3 of voters, each of these statements made them feel more favorable towards health systems. But the top testing ones focusing on prevention and early intervention to avoid more serious health issues, focusing on access for everybody in the communities and ensuring equitable care, and improving patient outcomes through better coordination of care. And now I'll toss it back to Jarrett.
Thanks, Luke. Before, well, I'll just keep rolling. So the next part of the survey, we spent one chunk of it focused on health systems and systemness, as Luke just walked you through. The second part was focused on nonprofit status and sort of how voters interpret that and what that means and how we can frame it and talk about it. So out of the gate, we asked a question about how if they view health systems as a corporation. We found that more than 80% of voters in this country generally view a health system as a corporation, which was a little bit of a surprising and striking finding. And then the second part here, more than 2/3 of voters say that a health system's designation as a nonprofit makes them view the system more favorably. So if you go ahead to the next slide. This was the question, do you generally view a health system as a corporation? You see the numbers on the left here. We actually added an intensity component to this where we didn't just say yes, no, we said strongly yes, yes, strongly no, no. And you see that 86% of voters say that they view a health system as a corporation, with more than 40% saying they feel this way strongly. And you see some of the groups on the right, the top groups who are more inclined to view health systems as corporations in the strongly camp. You can go to the next slide. This question, we asked if a hospital or health system is designated as nonprofit or operates as nonprofit, does that give you a more favorable or less favorable impression of it, or does it make no difference? You see the numbers here, 68% of voters say more favorable, just 10% say less favorable, and then 22% say it makes no difference. And then you see on the right side here, who does it have the most impact among? Well, again, 18 to 44-year-olds who tend to be the most cynical of the US healthcare system and of hospitals, and all the survey data we do, we see 18 to 44 typically tends to be the one has the highest negatives. You see that the voters in urban areas more inclined to be positively persuaded, although that's not to say those in suburban or rural areas aren't. You still have 64 and 68% who say they're more favorable. Democrats, and then hospitals in the news. We asked a question that's not in here today, but in the survey, how much have you seen, read, okay. How much have you seen, read, or heard about hospitals in the news? Folks who are seeing a lot or some about hospitals in the news are much more inclined to be more favorable towards a health system or hospital having a nonprofit designation. You can go to the next slide. And that leads us into this section. You can go to the next slide. This may not surprise folks, and I think this question has been asked elsewhere before. We did ask a question, is your preferred health system or the health system that you would be most likely to choose if you needed care a for-profit, a nonprofit, or are you unsure? You see that 66% say that they know their health system's designation. We did do a follow-up. We did have a question that asked them their preferred health system or the health system they would be most likely to choose if they needed care. So we haven't had a chance to do this yet, but we're going to go through and identify if they were correct in their assessment. There were a lot of organizations in here that whose names showed up just because your size and scale as the preferred system. But then you do have 34% who outright just say, I don't know. And so that's something that's, important to be mindful of, with the nonprofit status. They're just not aware. If you go ahead and go 2 slides, Stephanie, go to 23. So we also asked this question here, agree, disagree with the following statement. I don't know if any of the hospitals in my area are nonprofit. If they are, they don't advertise it. 83% of respondents in this survey agreed with that statement, including 35 who strongly agreed with that statement. So, whether they correctly identify you as a nonprofit or they correctly identify the for-profits as for-profit, what they're telling us here is that they're not sure, and oftentimes because they're not hearing about it from organizations themselves. You can go to the next one. This was a positive finding. Nearly 2/3 of voters believe that nonprofit health systems contribute to their communities beyond just providing medical care. In other words, all of the great things that you all do in terms of investments in the community, supporting local youth sports teams, things that don't actually involve delivering care, You see that almost 2/3 of voters in this country believe that nonprofit health systems are doing these kinds of things, are contributing to their communities beyond just delivering the care that you all provide. So we tested similar to what we did with the health system descriptions, the 4 health system descriptions that Luke showed you. We also tested a nonprofit description, and this one we just tested one, and I credit to the NSG team or Stephanie, or I think it was a combination of both sides who came up with the language we used because it resonated very well. So if you go to the next slide, this is the language, and apologies for the formatting issues. I was late to getting slides in, so the formatting looks a little bit off on some of these slides. That's my fault. This was the definition that we gave. We had them read it and react to it. So I'm just leaving it here for a minute. And then you can go ahead and go to the next slide. So the initial one you see on the left, Luke showed you that earlier. That was the initial rating of nonprofit health systems, 67% favorable, 15% unfavorable. That was the slide with 8 or 9 different things that we tested, including health insurance companies and corporations. After the description, we go from 67-15 to 82 favorable, 7 unfavorable, and perhaps more important, we see almost a doubling of the intensity, the very fav. So going from 22% to 42% very fav. In our world, our world of polling, of political polling, of policy polling, intensity is really important. Strongly approve of the job president's doing, the governor's doing, whomever. Much more likely to vote against someone because I learned this piece of information. Much more likely to purchase this product from a company because they do X, Y, and Z. Intensity is important, and anytime you have numbers above the mid-30s, you get into the 40s or 50s, that is a really, really good place to be. So just giving them a little bit of information about nonprofit, what all kind of the nonprofit entails of your organizations, you see this sort of just positive reaction from voters to your organizations. You can go to the next slide. We tested this question. We asked, here are some different aspects of nonprofit health systems. Please indicate whether it gives you a more favorable or less favorable impression of nonprofit health systems. 6 of these do well of the 7 we tested. You see the much more fav. I just talked about the intensity here being, anytime you're in the 40s or 50s, you're in a really good place. So for example, nonprofit health systems prioritize public health and community service over financial gain. Nonprofit health systems provide community benefits such as care regardless of patients' ability to pay. You see when they learn these things what their reaction is. It gives them a more favorable impression and a pretty healthy and much more favorable impression of nonprofit health systems. The one that we asked that sort of fell flat, so to speak, when we talk about nonprofit health systems are exempt from income taxes. Obviously, none of you are out there leading with that, but it is something that I know can be in the news or written about by journalists and the like. So we did want to test to see sort of what reaction there was to that. We were also kind of looking to see, did it evoke more of a less favorable reaction? It didn't really do that compared to the other ones. We didn't see, we don't see 30 or 40% here, but it's just not something that, people are going to be talking about. When we talk about the most important things that nonprofit health systems do, preventative screenings, prevention in general are the 2 most important things. So if you go to the next slide, you'll see we said nonprofit health systems offer a variety of services and benefits to the communities they serve. Which 2 of the following are the most important to you? So we gave them a first choice, and then they're allowed to choose a second one if they wanted. And you see the top 2 things here: preventative screenings, followed by prevention of chronic diseases. Other things as well, mental health services, cancer care, and then some other things that obviously are very important to your organizations and what you do: maternal care, substance abuse disorder, behavioral health services, rehabilitation services. But when you're talking about the value and sort of what you're doing as a nonprofit organization, if it were me, I'd be leading with prevention, followed by a little bit of mental health and oncology. You can go to the next one. We tested a few additional statements about nonprofit health systems in terms of things that you're doing in your communities. These are a little bit longer. And again, does this give you a more favorable or less favorable view? Does it make no difference in how you feel about nonprofit organizations, health systems, excuse me? Again, investing in preventative programs aimed at promoting healthier lifestyles and reducing the need for hospital visits is the winner, although it's not by much. You see the other ones all above 40% in that red column, much more favorable, and all of them sitting within 3 points of each other on the total more favorable. So, excuse me. This is one of those questions where you might look at the subgroups here, the crosstabs, to see which groups do these messages stand out, are they elevated among, and how's that differ by different groups? You can go to the next one. Sorry, Stephanie. So then we also tested this this statement, which two of the following do you believe best describes the contribution a nonprofit health system makes to its community? You see there's a clear winner here: ensuring all people in the community enjoy access to the healthcare they need, followed by impacting the people who live within the community, disease prevention and health promotion, investment in the community, and you see the rest of them. So this ensuring all people in the community enjoy access to the care they need was the one that best described the contribution that a nonprofit health system makes to its community. And then you can go ahead and jump to the next one. I'm going to move kind of quickly through these to get to the final part, and then I want to kick it over to the NSG team. When it comes to the services that nonprofits offer to their communities, education to promote wellness and providing behavioral health care were viewed as the most crucial. So we said, here are some things that nonprofit health systems do. Should they be doing these? Should they definitely be doing these? Should they maybe be doing these? And you see the numbers here, offering tools, resources, and education that helps promote wellness, and then providing behavioral health care, which includes mental and substance abuse prevention, were the top two. 60% in both cases definitely should do. And then you see some other things: job training, mobile clinics, programs that provide nutritional meals to individuals unable to afford food, and the like. The one that didn't really connect here, owning and operating fitness centers. Again, I don't think that's probably something that any of your organizations are leading with, but it just doesn't necessarily connect as something that nonprofit health systems should be doing. So we asked this question. We did this before we did the survey, we did what's called a qual board, which is sort of like an online focus group, only it's spread out over 2 days. So we had 30 some odd people participate from all over the country. And we asked this exact same question in the qual board, and we had a little bit of a different result, but we wanted to quantify it in the 1,200 person survey. And we said, which of these is most important for a nonprofit health system? And it was, as you can see here, pretty evenly split between the mission-driven statement, the charitable care statement, and the investing in sustainability efforts statement, in terms of what was viewed as most important for a nonprofit health system. When you look at the demographic group breakout here, there's a couple of groups that you see kind of a much higher, 40%, 43% for one of these statements, or much lower, in the mid to high 20s for one of these statements. But it kind of was interesting. We don't see this often, where even among the subgroups, so thinking about ethnicity, thinking about age range, thinking about education level, region in the country, there weren't really a lot of areas where we saw big differences, where one of people in the South said 50% mission driven, or 18 to 34-year-olds overwhelmingly said investing in sustainability efforts. It was pretty evenly split even in the subgroup data. So it was an interesting kind of in the discussion board. I think we had basically 50-50, with the sustainability one not receiving a single vote. So I'm glad we quantified it, because it turns out there are a lot of people in this country who that resonates with: supporting long-term health programs, improving access to care, et cetera, et cetera. If you go to the next slide. So we did a post after kind of going through some of those additional things that I just showed you on terms of benefits and services that nonprofit health systems provide. We did a post, we'll call it a final ballot, on nonprofit health systems. And you saw the one I talked about earlier, after just giving that description, going from 67 favorable to 82% favorable in the middle there. And then the final test, not nearly as big of a jump, but we go from 82 to 89, and we see that very fav number go almost to 50%. So again, the more that they learn about nonprofit health systems and all the things that you're doing, the more that they really dig in on their image and favorability towards you. And then we did do on the next slide what we refer to as a combat message. This is when we try to give kind of a paired statements that are in juxtaposition to each other. So we have a supporters of nonprofit health systems statement on the left here that say, they provide critical benefits to their communities, serve as the backbone of healthcare safety net, beyond, you see all the things that we talk about beyond charity care, offer essential services like 24/7 emergency care, substance abuse treatment, specialized care for chronic illnesses, train future doctors, conduct groundbreaking medical research, et cetera, et cetera. And then we had the opponent statement, which is the more cynical view, call it the Arnold Ventures view, perhaps. Nonprofit health systems often operate more like for-profit corporations, hundreds of millions of dollars of profit, executives getting paid millions. And then we said the mission of nonprofit systems is to serve those most in need, but with soaring profits and executive salaries. Were they helping? They're functioning like for-profit businesses. They should be required to pay taxes like for-profit entities. And you see it is pretty one-sided here, where 71% say that they side with supporters. Now, keep in mind, we had just given them a whole host of great things about nonprofit health systems. If we had led with this question, we might see a little bit of a different number if this was the starting point if in the survey. But the point here is the more they learn about you, the more they're going to be inclined to opt to that left side when they're hearing pushback from, be it payers, be it folks like Arnold, be it whomever, about nonprofit health systems. The more they hear, the more they learn, the more they understand, the more they're going to be inclined to side with the argument on the left side. And then the final thing we did, we did want to test some stuff around MAHA and sort of what role would nonprofit health systems or health systems in general, what role should they have in sort of the tenets of MAHA, taking away the Trump, Kennedy, but understanding, that the power dynamics in DC right now and trying to understand, are there areas to potentially work, and do something. We just want to understand how they reacted to MAHA and then also what sort of they viewed the role of health systems in it. MAHA resonated positively. I've seen this in a number of places now, from this poll, but other polls that we've done internally and some work that's been made public. It does have, when you strip away Trump and Kennedy, it does have a pretty positive connotation. Voters react really positively to sort of what the what the definition is. And then you see here, this was we asked the question, how much have you seen, read, or heard about Make America Healthy initiative, Make America Healthy Again initiative, known as MAHA. 62% said that they've seen, read, or heard at least something, with 38% saying that they have seen, read, or heard nothing at all. And then you see on the right side, the groups that are more inclined to say that they've seen, read, or heard a lot or some, versus those who said a little or nothing at all. As you might expect, you see Trump voters in there, you see Republicans, you see higher educated American voters, and then you see some different groups, 18 to 34-year-olds, folks in the mountain region, and so on. If you go to the next slide, so this was the definition we gave, that we tested, and then we said, just based on this definition, do you have a favorable or unfavorable view of the Make America Healthy Again initiative, or do you have no opinion? You see the numbers: 74% favorable, with 35% saying very favorable, and 12% saying unfavorable. And then we had two questions at the end, one of which was nonprofit health systems. What role should nonprofit health systems play in to improve the health of their patients and communities that they serve? And you see that the numbers here, 56% say large role, with 20% saying very large and 36% saying large in general. So a majority of Americans thinking that nonprofit health systems should have a large role in helping improve, supporting these health initiatives and improving the health of their communities. And then the final question we asked in the survey was, which of these entities do you think has the greatest ability to improve the health of your local communities? And you see nonprofit health systems and hospitals with 41%, followed by state and local government, 19%. And then you see the remaining ones that we tested. So more than 4 in 10 voters feel that nonprofit health systems and hospitals have the greatest ability to improve the health of the communities in which they serve. I know I went through that pretty quickly, a lot of ground to cover, but I also wanted to make sure we got kicked it over to the NSG team because they have some really good things to talk about in here.
Absolutely. Thank you so much, Jarrett and Luke. There were a couple questions that were in the chat. I think I covered them. Folks, if you have any other questions for Jarrett and Luke, please feel free to just document them in the chat, and we'll make sure that we get answers either next week during our comms cabinet call and future DRO monthly calls, or at any other time based on the nature and the depth of your question. Turning it over now to Carolyn and Dan, let me advance us into the next part of our discussion, which is how are we as TAA going to be using this information to drive our messaging, and what quick tips and tricks might we share with you all as you're thinking about incorporating this information in your current day-to-day messaging work streams. So Carolyn and Dan, I'll flip it over to y'all.
Stephanie, thank you so much, and I'll get us kicked off here. Just obviously, everyone, the sheer amount of expertise that's gathered in this room when it comes to communicating through a message that to boost our own organizations. Obviously, the minds here are already thinking about, okay, so how can we use these findings to fine tune what our messaging is? What do we want to be able to do? What we're going to share here is what TAA is thinking of, and from sort of a broad perspective, and whatever can be offered that can help further supplement or further fortify the messages that go out, and provide whatever tools and sort of tips that we can think of to be able to leverage this into it. Because as all of us know, there are the findings that we have, the data that we have on the language that really works, what really resonates with the public. But then we also have the additional sort of frame of what are people talking about right now? What's the conversation right now? And in fact, some of the questions in the chat sort of allude to this, especially when it comes to things like Medicaid. And, so that could be an evolving situation. We know we're dealing with a moving target, but these data really help us hone in on that moving target. And then, of course, there is whatever organization you're communicating specifically on behalf of. There could be special things that link directly with the data that Jarrett and Luke were just talking about. So all of that context sort of thrown into the background, we want to be able to share what we found in terms of how to potentially leverage this, and really this is where the rubber hits the road for the narrative. So I'm going to hand off to my colleague Carolyn.
Thanks, Dan. Appreciate it. Yeah, so as we heard from Jarrett and Luke here, this was the definition that we gave to participants just to kind of understand from them, like, does this provide an increase in favorability or not? And as we saw, it really did. And so as you see with this definition, it really talks about how health systems are the hub of the community. They're reinvesting in the community. They're really taking care of their own community. So that type of language and those types of themes really resonate well with the general public. And we can go to the next slide, Stephanie. Okay, and then from there, as you can see, we have these 4 really emerging themes here. So going to the access to healthcare, around that idea again, being a local hub to the community, quality care, having that patient-centric experience, having more of that one-on-one time with the doctor. In addition to that, around this idea of preventative and early intervention services. So providing screenings that will help prevent chronic diseases that ultimately will have less stays at the hospital. And then, of course, idea again around reinvesting into the community. So how can we take these themes and really start working those in to our own messaging when we're communicating around health systems, because that is going to give us a more favorable opinion to the public. So really making sure that we're honing in on these themes when we are communicating. And Stephanie, you can go to the next slide. Okay, and then here, as Jarrett and Luke said, these were 4 kind of other themes that we looked at and definitions that we tested with the public just to kind of get their idea. Is this provide a favorable opinion of health systems or not? And so as you can see here, kind of high level, these all did have an increase in favorability. So when we are, talking around health systems, these are some 4 key themes that we should be leaning in on when we're talking in kind of the general public area.
And one thing that we'll kind of add here too is that this is where it gets really interesting from region to region, locality to locality, depending on the audience that you're actually reaching out to. There could be, as you know, different ways to kind of use these themes as a springboard for the things that systems are already doing individually and how they serve their communities. We know that just as the public is not monolithic, neither are individual health systems and what they offer. So these themes hopefully will provide sort of a guiding post in terms of what might be resonating within the community and how to best communicate it.
And then from there, we kind of took all this data and crafted our own key messaging that we're going to use when we talk about nonprofit health system, hospital systems. So you'll see here, we're using hospital systems instead of health systems when we talk about nonprofit hospital systems, just based on the data saying that it tested a little bit more favorably. You'll see here another theme that we talk about here: coordinated comprehensive care to patients, working in that chronic preventative service for chronic diseases. And then of course this idea around investing in the community as well. So this messaging is going to be our key messaging when we're talking about nonprofit hospital systems. And you'll see a little bit, it'll be tweaked a little bit when we may have research that comes out just based on the data, but this will really be the core messaging when we're speaking to nonprofit hospital systems. And I think the takeaway here is looking kind of at your own messaging and seeing if there's anything that you could add into that as well. And I think one big example that we saw that tested really well is this idea of using nonprofit before hospital system or health systems and seeing that jump in favorability. So that's, I think, really one key thing that we can do to kind of help increase that favorability to the general public. And then we can go to the next slide. Okay, and then this is really we like to call it the tips and tricks kind of to help guide when we're talking around messaging. And so you'll see here we have 2 columns. We have the increase in favorability and then maybe some things that didn't really increase favorability or maybe had a negative impact. And so like we talked about just before on the slide before, this idea around including nonprofit before hospital system or health system. Hospital systems having this stronger favorability to the general public, using this theme around local hub, instead of using, messaging like cutting or enhancing efficiency, using language lowering healthcare expenses, enhancing affordability. That type of language tested a little bit better and more favorably to the general public than phrases such as streamlining, cutting, or enhancing efficiency. The other thing that, we talked about here is communicating preventative services. That tested pretty well right now. You'll see on the other end that we have these areas around substance abuse disorder, maternal care, rehabilitation, and behavioral health services. I think when we did the testing right now, that may not have been something top of mind to the general public, but I think the one caveat just to kind of mention there is that could be ever changing. Right now, preventative service is what's top of mind to people, but in general, this is kind of what they decided was more top of mind to them than these other categories. The last thing here that I know Jarrett and Luke touched upon is around this idea of the MAHA. And so for us, really, we don't want to directly tie into it, but if there are themes around things like preventative screenings where there is a little bit of a tie, but we don't directly tie into this idea of MAHA, I think will actually gain us some favorability there. And then the other thing that I know Jared and Luke kind of touched upon is, health systems primarily viewed as corporations. And then this idea, talking around tax exempt doesn't really increase much favorability there either.
And just to follow up on what Carolyn mentioned too, the order that you see in these columns is actually quite intentional because there are certain things that we saw that really do tend to work. Like it does seem like nonprofit really does work. As we get further down in the list, especially when it comes to something that is as much of a lightning rod as MAHA or anything that's promoted by the administration, and people have strong feelings one way or the other. That is potentially subject to change, but being able to navigate around that and really get to the crux of the matter when it comes to preventive care, things that people can actually get behind, that's going to be sort of the strategy and the tactics here, and that's probably something with which this group is already very familiar.
Okay, and then our last slide here is really one level down to kind of help you guys to, when we talk like almost like a checklist kind of system, starting with positioning, identifying, is it as a nonprofit, a hospital system, then going kind of to this next category around these key benefits, right? If it fits into kind of one of these key benefits, something we want to communicate about. And then going in and kind of the next step when we're looking for, content here, even on our own LinkedIn page for TAA, these are kind of the themes we're looking for. If you have initiatives, if you have different programs kind of going on and we're able to promote that, this is kind of a helpful one slider that you can look at, and then we can gather that content and of course continue to promote that on our own LinkedIn page as well.